Hello, and welcome. As many of you know, I recently underwent upper eyelid surgery, known medically as upper blepharoplasty. This is something I've been contemplating for nearly 20 years, and I finally decided to move forward with the procedure. I chose Dr. Scott Gayner, a close friend and colleague I trained with. Today, I want to take you through the surgery itself. While we have other videos that detail the steps of this procedure, this particular video captures my personal experience, which we've decided to share on the channel. Typically, patients are given Valium to help them relax during the procedure. Once we were in the operating suite, the first step was to carefully measure and mark the eyelids. We typically locate the natural crease, which is often between 8 to 12 millimeters from the lash line. In my case, my natural crease was at 7 millimeters. If one side measured at 7 millimeters and the other at 8 millimeters, we would average them to about 7.5 millimeters to ensure symmetry. Next, we mark the redundant tissue, as you can see in the video. By gently grasping the excess skin with forceps, we can measure and mark the tissue that needs to be removed. It's important to be conservative, especially in men, to avoid feminizing the eyelid. The goal is to rejuvenate the eyes without overdoing it. After marking, the eyelids are injected with a local anesthetic that contains lidocaine and epinephrine. The epinephrine constricts blood vessels, which makes the procedure virtually bloodless and minimizes bruising. When patients undergo IV sedation or general anesthesia, which I believe is often unnecessary, the localization of the tissue isn't as precise, leading to more bleeding, longer recovery times, and more bruising. Once the eyelids were measured and marked, I was draped with sterile towels, and the surgical field was prepared. I'd like to clarify that head and neck, or facial plastic surgeries, are technically considered clean rather than sterile procedures. While all instruments and gloves are sterile, the field includes areas like the eyes, ears, nose, and mouth, which are not sterile by definition. However, due to the rich blood supply to the head and neck, infections are rare. As the procedure began, Dr. Gayner wore a bright headlight for better visibility and started on my right side. He used a number 15 blade scalpel to make the incision along the marks we'd made earlier. There was minimal bleeding, thanks to the epinephrine and the anesthetic. A common question I get is whether we use a laser for this procedure. I used to, but the risk of corneal scratches from the protective shields required for laser use outweighed the benefits. So, we prefer using a scalpel for this step. In my case, there wasn't much fat in the medial aspect of my eyelids, so Dr. Gayner focused on removing the redundant skin. After ensuring there was no bleeding, he closed the incision with a permanent suture, which will need to be removed in about 6 to 7 days. The suture was placed in a running subcuticular manner, meaning it's hidden beneath the skin for a cleaner result. Once the right eyelid was complete, we immediately applied ice to the area and began the same process on the left side. You won't see fat removal in this video because it wasn't necessary for my procedure, but we have shown this in other videos. It's worth mentioning that when fat removal is needed, we're much more conservative these days. Maintaining some fullness in the upper eyelid actually gives a more youthful appearance. In a nutshell, that was my upper eyelid surgery. I've already shared some day-by-day updates, but we wanted to publish this video due to the many requests we received. Thank you for your interest and for allowing me to share my journey with you. Stay tuned for more updates.